maybe you can speak a little bit about variational AI and sort of what the organization does.
Sure. So we are a Vancouver-based startup. We have developed a foundation model for small molecule drug discovery. The platform is called Anki. And what Anki does is very similar to what a diffusion model does for image generation. So if you've ever played with, Stable Diffusion or with Midjourney, you type out a text prompt, and then whatever you type out, it can create an image that fits the text prompt. We basically do the same kind of thing, but instead of text to define the image that you want, we use a language of chemistry. And so we use chemical property definitions that are usually contained in something called a target product profile. And in this case, it's a preclinical target product profile where a biotech or a pharma company is looking to generate sort of early stage, leads and then optimize these leads. And if they achieve these TPP metrics, then they move forward and nominate the drug to go into further development and then eventually into the clinic and hopefully into the patient population. So what we do is essentially take that target product profile, which is usually quite detailed in terms of the properties that you want in a small molecule, and we generate a molecular structure based on that requirement. And so because we can do it like a foundation model, because we can do it on a pre-trained model, it's a lot more efficient, it's a lot faster, but more importantly, it's able to generate novel chemical structures. And for all those chemists who are out there who have a biologist who says, hey, we figured out that if we inhibit this, protein, that it due to this mechanism of action, we're going to be able to, cure diabetes or something. And now all you have to do, chemist, is make me a molecule that does all of these things. And then the biologist goes, okay, I'm done. I've done the hard part. Of course, the chemistry is also really hard. So biology is extremely complex. Finding out whether or not that target is good is a massively difficult proposition. But that kind of trivializes the difficulty of finding a small molecule. In our case, we only do small molecules. In biologics, it's a bit different. So we help the chemists. And so that's really what we do, is we are AI for generative chemistry. And it so happens that we focus on therapeutics. And we can do this we're target agnostic. So we're not specific to any kind of indication or disease area. We are specific to targets. But the good thing about biology is targets can be implicated in a broad range of diseases. And so at first we started out with a bit of a focus on oncology, but then we're into immunology, you're into CNS, you're into all of these other disease areas. And now we're working on everything from atopic dermatitis all the way to obesity. And because our ability to design new small molecules with exquisite selectivity and potency and safety for any given sort of target, that really opens up a lot of white space for us.